Wednesday.
Happy Wednesday. So today we're doing one of my favorite procedures, the arm lift, arm reduction brachioplasty. And this patient comes all the way from Michigan. She has tried her hardest to get her arms as skinny as possible. She diets, she exercises all the time, but she just can't get rid of this extra skin flab right here. So it's a very hard area to tone. It's this posterior triceps region, and even though you can do a lot of biceps curls and triceps curls, it's really hard to get this area to snap back. So what we're going to be doing is a brachioplasty, an arm lift, arm reduction. So if I were to just do arm liposuction here, she'd be left with a lot of hanging skin. She's in her mid-50s, she has a couple little stretch marks here, no significant weight fluctuation along the way, but if I were to just do liposuction, even if I use Renuvion or J-Plasma, that skin would not snap back. So what we need to do is an incision from the armpit out to the elbow, curve slightly behind the elbow, and I'm going to get her nice skinny arms, nice tight arms like this. So I've done my dissection. I'm very happy with the amount of excess skin and fat I've resected here. And now I'm just using these towel clamps to measure the tension between the skin flaps. So this will allow me to accurately predict how much skin I can get out safely and also get all the skin back together again. 2, 4, 6, 7. I always use 7 clamps. That allows me to put everything back together equally. I don't use drains on the arm lift. I don't see any need. This area doesn't drain much. I do like to use the pain pump because it minimizes the pain, number one. And then number two, minimizes the need to take oral narcotics, decreasing the potential for addiction and also decreasing the potential for complications as well as constipation. So I'm using this towel clamp and this towel clamp, number 1 towel clamps, to measure the tension. Can I get this out? Yeah, easily. Can I get out a little bit more? I think so. So we're going to mobilize this towel clamp a little bit more posteriorly here, maybe like about 2 millimeters. And yeah, that feels good and tight. And I can get that out safely. Number 2 towel clamp, can I do that? Can I do the same? Yep, that looks good. And can I take out a little bit more? Yep. Maybe a couple of more millimeters here, and that looks good and tight. So I use my towel clamps here to set this base. That's where the scar is going to be. That's the foundation. So this line doesn't move, but the variable line is this line here, what the amount of skin and fat that I can take out here posteriorly. So that's the line that it could be up here, it could be back here, it could be along here. So this is the amount of skin that I want to remove, sort of between this towel clamp and that towel clamp. So I'm going to make my definitive incision.
Fly me to the moon and let me play among the stars. Let me see what spring is like on Jupiter and Mars. In other words, hold my hand. In other words, baby, kiss me. Fill my heart with song and let me sing forevermore. You are all
I think something like that would be really good for her. We get a lot of revisions of other plastic surgeons' arm lift failures, and a lot of the time it's in this arm elbow area where not enough skin and fat was removed. So now I'm just going to bring this all back together and reapproximate it with multiple layers of sutures. I don't use drains again. And now I'm just going to work out this little dog ear here in the armpit. And everyone does get a little bit of a dog ear here unless you treat it with the little excision here, this little wedge. Mark her first.
Fill my heart with song and let me sing forevermore. You are all I long for, all I worship and adore. In other words, please.
So I'm done here. Again, I made my incision from the armpit out to the elbow, curved behind the elbow here to get rid of that overlap there, curved it into the armpit here to get rid of that dog ear, and she's got nice skinny arms now. No excess skin hanging, no excess fat hanging, and the scar is concealed on the inside portion of her arm, so when her arm is down by her side, you're not going to see that scar. Again, I don't use drains, but I do use a pain pump. You can see it in here, and it's going to sprinkle in lidocaine here post-operatively to minimize the pain. So there you have it, longitudinal brachioplasty for a patient that had excess skin and fat from pretty much the armpit to the elbow and really didn't like that excess, in a middle-aged female in her 50s with some stretch marks. So that's how we do a longitudinal medial arm lift. Thanks for watching. Please subscribe. We'll see you next time.